Hello, this is a presentation about valve defects narrated and created by Kelsey Marckstadt. What exactly are the causes and effects of valve defects? In this presentation, I will describe a few of the most common forms of heart defects found today. There are at least 18 different types of congenital heart defects with many additional anatomical variations. For example, coarctation of the aorta, or aortic coarctation, is a narrowing of the aorta, the large blood vessel that branches off of your heart and delivers oxygen-rich blood to your body. When this occurs, your heart must pump harder to force blood through the narrow part of the aorta. Coarctation of the aorta is generally present at birth. Pulmonary valve stenosis is a condition in which the flow of blood from your heart to your lungs is slowed by a deformity on or near your pulmonary valve, the tissue that controls the blood flow from your heart to your lungs. Adults occasionally have the condition as a complication of another illness, but most of the time, pulmonary valve stenosis develops before birth as a congenital heart defect. Truncus arteriosus ventricular septal defect occurs when a person has one large artery instead of two separate ones to carry blood to the lungs and to the body. It develops during fetal growth when a baby's heart is developing. In most cases, the cause is unknown. In a normal heart, the blood follows this cycle: body to heart to lungs to heart back to the body. When a person has truncus arteriosus, the blood leaving the heart does not follow this path. It has only one vessel instead of two separate ones for the lungs and body. With only one artery, there is no specific path to the lungs for oxygen before returning to the heart to deliver oxygen to the body again. There are three general causes of valve defects, and the first one is congenital heart defects. These are birth defects and typically diagnosed at birth or in adolescence. Another cause of valve defect is cardiomyopathy, or the disease of the heart muscle itself. This includes cardiac swelling, which can lead to the valve damage and seepage. Age can be another cause to the possible development of a valve defect. Due to the constant change in blood pressure and heart rate, the valves are constantly expanding and contracting, degrading the tissue. How one lives their life also affects how the valves are taken care of. If you are someone with a valve defect or know of someone who has a valve defect, there is treatment, so all hope isn't lost. For valve diseases that develop over the course of a lifetime, the best and easiest treatment is preventative with diet and exercise to maintain cardiovascular efficiency. If the problem is a birth defect or the problem is caught after damage is more severe, then the issue must be solved with medication, orthoscopic surgery, or a combination of both. This has been a presentation on valve defects for Professor Misty Patron, Bio 210, Anatomy and Physiology.